Hello, my name is Shakray. I'm going to be your student nurse today.
Hello, how are you?
I'm
nice
good.
to meet you.
Nice to meet you too. So today I'm going to perform an abdominal assessment on you.
Okay.
So I guess before we begin, do I have your consent for that?
Absolutely. I saw that on the form. Yes, I do consent to you doing this assessment today as well as a videotape.
Great. Well, thank you. Okay, so before we begin, let me go ahead and disinfect my hands. Okay. And let me disinfect my stethoscope. Okay, sir. Can you state your name and date of birth for me?
My name is Craig Smith and my date of birth is November 13th, 1954.
Okay, I'm going to look at your wristband for you. Okay, everything looks good. How is your pain right now? 0 being no pain, 10 being max amount of pain.
0, no pain.
Great. Do you have any type of allergies to any type of medication, food, anything that I should know about?
No allergies, no to any foods that I know of.
Okay, great. So today I'm going to be performing an abdominal assessment on you today. I'm going to be inspecting your abdominal region, looking at any type of abnormalities, scars, lesion. I'm going to be also taking that area, listening for any type of abnormal sounds. I'll be palpating, which is feeling around in that area, and feeling around, also percussing to see for any type of abnormal sounds.
Okay.
Do I have your consent for that today?
You do have my consent.
Great. So, at the start of it, let me go ahead and have you lay down. So if you can go ahead and just lay down here for me. Scoot down as far as possible. Thank you very much. Okay. Okay. Can you scoot down just a little bit more for me? Thank you. Yep, as flat as possible. Have your knees up like this. A little bit lower. Are you comfortable?
Yes.
Okay, great. And the reason why I'm asking you to put your knees up like this is so it prevents any type of guarding, any tightening of the abdominal muscles. I need it to be completely relaxed for
No
this
problem.
assessment. Okay, sir? I'm going to pull your shirt up to inspect your abdominal region. Go ahead. Oh, okay. So I'm looking at the abdomen area. It's of perfect symmetry. It's of good symmetry. There's nothing abnormal about it. I'm also looking at the contour of it. There's no flatness, no rounding, no protuberance. Everything looks good in that area. Contour is normal. The skin color is normal. There's no redness, no flushing. There's no lesions, wounds, abnormalities. I also don't see any type of pulsating. Because if we see any type of pulsating with the abdomen area, it can indicate an aneurysm or start of an aneurysm, in the abdominal area. Also, just of course, I don't see any tubes, any ostomy bags, or any ostomies. So that's me. So I'm done inspecting your abdomen area. It looks normal.
Okay.
So now what I'm going to do is I'm going to check for bruit. I'm going to look in your, check in your aortic area. And I'm listening for a bruit, and I don't hear any. So that could, if I would hear something, it's normal sound. If I was to hear anything, like right now, it would be like a sign of some type of blockage. So it's normal sound, so there's no bruit in your aortic region. So now what I'm going to do is I'm going to auscultate your abdominal region. I'm going to go clockwise. Listen for any type of abnormal sounds.
Okay.
Okay. So I'm going to start in your right lower quadrant area. Normal active, no abnormal sounds. Now in your right upper quadrant area. Normal active. Now in your left upper quadrant area. Normal active. Now in your lower left quadrant area. Normal active. So I don't hear any type of abnormal sounds, no hyperactive sounds, hypoactive sounds. It sounds normal. So everything is good in that region as far as that goes. So next what I'm going to do is percuss Your areas, I'm gonna go in the same order as I did last time, clockwise, okay?
Yep.
And this sounds tympanic. Tympanic. And then when I'm doing it, I'm gonna do it again. I'm in the, what I'm in is the right lower quadrant area. Moving my way up to the right upper quadrant area. The sounds are tympanic, no dullness. I'm over in the left upper quadrant area and I'm moving down to the left lower quadrant area. And these sounds are tympanic, so those are normal sounds. So no dullness, no abnormalities with that, okay?
Right.
Next, what I'm gonna do is I'm going to palpate your area. It's gonna be a light palpation. Normally with these assessments, there's a deep palpation involved, which is 5 to 8 centimeters, but I'm not gonna do that today for that assessment.
Okay.
So I'm just gonna do a light palpation, of course, same order. So I'm gonna start over here, which is the right lower quadrant area. I'm feeling for any type of abnormalities. Moving up, I don't feel any type of abnormalities with that. I'm now in the right upper quadrant area. Feeling around. No abnormalities. No masses, no lesions, nothing abnormal. So it feels normal in your abdominal region.
Great.
All right. So what I'm going to do next is I'm going to look into your costovertebral angle. Okay. So if you can go ahead, so that concludes me looking at the abdominal region. So if you can go ahead and sit up for me. Okay. Just go ahead and turn this way. Okay. Okay. You can scoot up a little bit for me. There you go. Okay. All right. Yep. Any type of tenderness?
No.
Okay. Any type of tenderness?
No.
That's the costovertebral angle. No tenderness. So that's normal. Because if there was any type of tenderness, that would be like a sign of an abnormality. Okay? So how do you feel right now pain-wise? 0 being no pain, 10 being maximum amount of pain.
0, no pain.
0, no pain. Okay, great. All right, sir. So that's going to conclude our abdominal assessment today. Thank you so much for your time today.
You're welcome. No problem. That was easy.
All right.